students. So next topic under the endocrine system disorders is diabetes, and this will be the last topic for the endocrine system disorders. So let's get started. So diabetes, or simply known as blood sugar, is a chronic disease of pancreas. It actually occurs when the pancreas they are not able to produce the insulin hormone, okay, which is the main thing to keep the blood sugar levels intact. Okay, if the insulin is produced more than the required, then it is hyperglycemia, okay, which is a common effect of uncontrolled diabetes. Okay, in some cases there will be the hypoglycemic cases also. Okay, the hyperglycemia can lead to damages of your body system, various body system damages like the nerve damage, kidney damage, or blood vessel damage. Okay, so there are basically three types called type 1 diabetes, type 2 diabetes, gestational diabetes, and there is one other thing that is pre-diabetes. Okay, type 1 diabetes is an autoimmune diabetes, okay, in which your own immune system strikes back at you, okay, and destroys the cells which are being produced in pancreas, okay, so that affect the production of insulin, okay, but the cause is actually unclear. Why they attack, it is unclear. So about 10% of people they have type 1 diabetes. If we talk about type 2 diabetes, okay, it is the thing happening when your body becomes insulin resistant. Okay, so the more sugar is going to be produced in the body, or called diabetes mellitus. Okay, then come the gestational diabetes. This is also a hypoglycemic condition, okay, but it occurs during pregnancy. Okay, and the pre-diabetes occur when your blood sugar levels are higher than the normal but not able to be diagnosed for the type 2 diabetes. That is called pre-diabetes or reverse diabetes. Symptoms, if we talk about, then the type 1 has the symptoms like extreme hunger or feel for increased thirst, or you will be losing your weight without intentional conditions, or you are going for frequent urinations, having blurry vision and tiredness. Whereas type 2 diabetes as well as the pre-diabetes, they have the same symptoms as increased hunger, increased thirst, increased urination, bloody vision and tiredness. Along with that, you will have sores in your heels. Okay, when we talk about the gestational diabetes, okay, in this condition mostly it is asymptomatic, means there are no symptoms, but doctor will going to check you for the diabetes when he going to check the glucose tolerance test for you in the pregnancy period of 24th to 28th week. Okay, then we come to causes. First we will be talking about the causes according to the type. So type 1, there are no specific causes, but if we talk about the causes even in it, then there will be some viral or bacterial infections or chemical toxins or unidentified component causing the autoimmune reaction. If we talk about type 2 and pre-diabetes, then it will be the obesity, or when you are living sedentary lifestyle, means you are living alone, taking junk food like that. Okay, increasing age and bad diet. We talk about gestational, then the causes are the family history, okay, overweight, obese, or when you are having PCOS, that is polycystic ovary syndrome. We have done this in reproductive system, and when you have had a large baby weighing over 9, means you have given birth to a baby whose weight is more than 9 lbs. Okay, the other diabetic causes which are the potential causes include pancreatitis, okay, problem of pancreas, polycystic ovarian syndrome, then the Cushing syndrome, then the glucagonoma. This is the condition which is having the lack of equilibrium between the production and usage of insulin and glucagon. And last one is the steroid induced diabetes or steroid diabetes. It's a rare form of diabetes, but it occurs when you are taking steroids for the glucocorticoid therapy. Okay. If we talk about risk factors, then the type 1 is having risk factors like when you are having age of child or teenage, you are at risk. When your parents have this condition, or when you carry the genes that are linked to the disease. Okay, again, so type 2 and pre-diabetes, they are having same symptoms like overweight, or when you are having age more than 45, or when you are old. Okay, when your parents have the condition, or when you are not active physically, or when you have the gestational diabetes, or when you have the pre-diabetes, or you have the conditions like high blood pressure, high cholesterol, high triglycerides, or if you belong to a community like African American, Hispanic, Latino American, Alaska natives, Pacific Islander, American Indians, or Asian American ancestry. To talk about the gestational, then the risk factors again are overweight, you are over the age 25, or had gestational diabetes during past pregnancy, have given birth to a baby weighing more than 9 pounds, or have a history of type 2 diabetes, or if you are having PCOS. Keep in mind this is for the mothers. Now the complication. If we talk about the diabetes, then you may get complications related to heart disease, heart attack or stroke. Then you can have the nervous system problem or kidney problem or vision problem or hearing problem, having problem. Then you may have skin problems, depression and dementia. If we talk about the gestational, then you can have premature birth problem, higher than normal weight birth, or type 2 diabetes risk, low blood sugar, jaundice, or stillbirth. Stillbirth means dead birth. Okay, diagnose. So your doctor will diagnose upon you depending upon your medical history, your signs and symptoms. But basically it goes around few blood tests like fasting, random postprandial blood sugar, glucose tolerance test, insulin tolerance test, and blood sugar level for gestational diabetes to be checked between 24th to 28th week of the pregnancy. Other than that, they can also go for the urine determination. So treatment of the diabetes include basically the healthy diet. You are not going to take the junk food. You need to take the insulin if you are being detected for the diabetes. You need to monitor your blood sugar level daily and the medication being prescribed by your doctor. So thank you. We have completed our endocrine system disorders.